Well, I've known Kevin for over 20 years, playing golf at Chippeney with him, and it wasn't until 2018, I think, that we started coming to him as a primary care physician. At that time, I weighed 200 pounds. I was on blood pressure medication. I was on cholesterol medication. Since that time, I now weigh 170 pounds. Never did anything but listen to what Kevin had to say. And first thing he had us do, he said, read this book, The Plant Paradox by Dr. Stephen Gundry.
We keep it for reference, too.
Right.
The whole lectin-free, it's not a diet. I have a lot of friends that'll say, oh, I've got a wedding, or I've got this, I'm gonna go on this diet, I'm gonna go on the cabbage soup diet, I'm gonna go on this diet. This is a way of life, and it's a great way. I never thought I would be dairy-free, completely dairy-free.
You look at our blood work when we first came to Kevin, blood work has done nothing but improve over all the years. He is incredibly thorough. I'm sure a lot of primary care docs now, because of the consolidation and the hospital groups buying, different practices, it's a machine and you're on a timer, and Kevin is much different. He takes the time, he gets to know you, he gets to know your family, he celebrates when you're doing better. So that's Dr. Greene. I mean, he's a very, very special, caring person who wants to see people do well. And when he tells us something is the right thing to do, we do it. We've gone through chelation to get heavy metals out of our bodies. Seen the improvement in those metals coming out through 3 rounds of chelation. And Peter Attia talks a lot about your diet and your health, and he talks about medicine 3.0, and the world is on medicine 2.0, but medicine 3.0 is the things that Kevin has done, and Kevin has modeled a lot of the things he's done after Dr. Attia, but it's about stepping it up. So not only walking 10,000 steps a day, but getting in zone 2 training and getting that heart rate up there into intense and vigorous zone 2 4 times a week at 45 minutes.
That's the new thing that we're doing.
That's what we're doing now. So what Kevin talks about too is, when you reach 70 and you reach 75, things start dropping off the table, and you have to be prepared for it. So how do you prepare for it? His metal lab is fantastic. I've gone through it. First, cognitive training and testing where you're at in terms of recognition, and then grip strength. Testing grip strength and how important that is for good health. Ray Wiley Hubbard is one of my favorite singer-songwriters, and he's got a line in one of his songs that says, it's a great day when my gratitude exceeds my expectation. I have a lot of gratitude and a lot of thanks to give to Dr. Kevin Greene for what he did, for me, because as the leader of a company, you got to be sharp. You have to be in tune. You have to be looking at goals. You have to be looking down the road.